Well, I'm really excited we were able to get this together, Nicole.
Yeah, this is very cool. What are we going to call it?
Well, how about one of two things? How about either the Dean and the Queen?
Not bad, not bad.
Factual.
Factual.
Or,
kind of weird.
Or the Crown
Oh, gosh.
and the Clown.
Yeah, no, that doesn't work.
Why not?
We can't call you a clown,
But
for goodness sake.
it rhymes, and there's not much that rhymes with tiara, so I couldn't go with that.
I appreciate being called an object. Thank you.
And you know, sometimes actually you're more serious than I am, even though I'm deanly. But yeah, neither one of those really works. Deanly is actually, yeah, you can say that. It's an adverb. Like every time that I'm being like this and being a little silly, somebody will tell me you're not being very deanly. I think that's because traditionally most deans were deanly. Very straightforward.
Ruler in the hand, kind of.
Exactly, ruler in the hand, stick wherever sticks go, and yeah, those kind of things.
So you have a simulation center that you've built, and what exactly are you simulating?
It's very cool. It's like going to Disney and you go to the Back to the Future ride and the Star Wars ride, you're living it. Well, you can actually do a cardiac catheterization, or you can do surgery in this three-dimensional model and then have your skills assessed objectively.
Okay.
So think about how great that will be to know, as a doctor, boy, how am I doing compared to other folks? But most importantly, for a medical staff or for a patient, you'll know that your doctor has been, if you will, certified objectively.
Tomorrow's medicine today is considering the environment and the emotion and the mental anguish of that person who had that procedure done. And you're not going to make them wait this exorbitant amount of time for results on things that could happen immediately.
Yeah, and I think tomorrow's medicine is going to happen right away, and the reason is not going to be because of docs. It's going to be, I think, the generation that's coming up that will need health care is, I mean, if you can't chat with somebody in more than 140 characters and you have to tweet, you're certainly not going to wait 9.2 days to get your mammogram back, right?
Not.
All right. So,
no.
I mean, you have this generation, my kids have literally grown up with the I want something instantly, and it doesn't matter if it's in Tampa or wherever, I expect to get it on Amazon the next day, or I expect to be able to communicate with my friend right away. Now, can you imagine that generation saying, okay, now let me get this clearer. It takes 9 days to get my mammogram back, that takes a minute, and the reason for that is because when you want to read it, and when your transcriptionist comes in,
no dice.
No, I mean, that would be like going back to saying, I think I'll just mail somebody a letter. I mean, that doesn't happen.
I'll take my services to somebody who will do it in the way that I like to communicate.
So that's what we call, in Tampa, the entrepreneurial academic model. Now, if I was a dean 20 years ago and I put those two words in the same sentence, I'd be excommunicated from deandom. I don't know if there's a deandom, but I would be excommunicated. But now that concept is really taking hold.
What thing or what concept from Star Trek, because you've done research on Star Trek, is the next greatest thing in healthcare? Well,
I think the obvious answer would be the transponder. So if you remember the docs, every doc has literally had a transponder that they can just go like this and have everything you need.
Right.
So that's the obvious technologic thing. But I actually think that if you actually watch Star Trek, and I'm going to sound like a real Trekkie here, but if you actually watch it through the ages, what you'll find is, as technology got greater and it reached a certain peak, it then went beyond that, where docs became more caring. So when you think about, literally the last iteration of Star Trek, it literally was physicians saying, in Enterprise, physicians saying, well, I need to really care for this patient no matter what species it is. And when you think about the first generation of Star Trek, right, it was Bones going, if it was a organism that was made of rock, he'd say, I'm a doctor, I'm not a geologist, or I'm a doctor, I'm not an insectologist or entomologist. But what he would do in the last one was, whatever the species is, I need to take care of. So it's what I learned from Star Trek is it's that combination of empathy and technology. But it's something we can learn in 2009.
Why is it that doctors don't often talk to patients about the really personal aspects of their disease?
It's a great question, Nicole. It really has to do with how we select and educate docs. I think the way we select and educate docs, we almost force that kind of aloofness.
Really?
Yeah, when you think about it, we did a study with some friends of mine from Wharton where we looked at how physicians handle change. And what we found is that the way we select and educate physicians, we've joined a cult.
A cult.
Yeah, it's really like a cult
The
because,
physician cult.
well, yeah, think about this for a second. From the very beginning when you decide to become a doc, it's look to the left of you, look to the right of you, one of you will get into medical school. And then you get into medical school based on what? Your science GPA,
Numbers,
your
numbers, and more
MedCats,
numbers.
and organic chemistry grade. And then we expect you to be sort of this interdependent organism that's empathetic and communicative and funny. It just doesn't happen. I mean, I can tell you, since I've been on both sides, my brain's divided in half. I have an MBA side of my brain and a doc side of my brain. Now, when you go to MBA school, they actually tell you the most important decision you'll make is your study group.
Really?
Ask me why.
Why?
Okay, because the reason is that every grade you get at Wharton is a study group grade.
Oh, okay. So you're only as good as the group is.
Yeah, now it wasn't very fun for me.
Why not?
Well, because they throw the 100 of you in a room and they say, get somebody from accounting, somebody from finance, somebody from management, somebody from marketing, because this is a very important decision in your study group.
Right.
So these are Wharton folks, so they're pretty serious.
So they're seeking
So they
out
went up
the-
to me and they said, so what are you? And I said, I'm a gynecologist. And I was literally, true story, the last person left without a study group.
What is it that you can say from your experience that would motivate the patient audience who would watch a program like this to demand tomorrow's medicine today and not yesterday's medicine?
Well, that's a great question. I think I'll tell you what I'd say to patients, and I'll tell you what I'd say to docs, if I could try to bring that closer together. The first thing is, from a patient point of view, they need to demand the same level of service that they get in everything else in health. There's no reason not to. We can do it. We're smart people. And if patients come in and say, remember that movie Network, I'm mad as hell and I'm not going to take it anymore?
Yeah.
I'm mad as hell and I'm not going to get a scribbled prescription. Or I'm not going to wait 9 days for a mammogram. Or I'm not going to be on hold for 30 minutes. Those are all service issues that we can handle. So I would hope that patients will start to demand more from their physicians, and we'll do it. And from a physician point of view, I would ask them to think about the day that they got their acceptance to medical school, how passionate they were about healing people, about talking to people. Nobody got their acceptance to medical school and said, boy, I can't wait to read MRIs, or I can't wait to look at an x-ray. What they said was, I can't wait to be in a career where I'm looking across from somebody that I've just delivered their baby, or I've just helped a family member, or even I've just consoled someone who lost someone. That's what they went into it for. And we tend to lose some of it. We tend to lose that passion.
Yeah.
And I think what needs to happen is, I think we should have this exercise where, every few months you get recharged and you go back, maybe hypnosis, go back and think about what it felt like when you first received that admissions letter.